We will discuss the top 7 causes of right lower abdominal pain. This area is located below the belly button on the right side, containing several organs such as the appendix, a portion of the large intestine, part of the small intestine, the right ovary, the kidney, and the fallopian tube. If a person experiences right lower abdominal pain, the first condition to consider is appendicitis, which is an inflammation of the appendix. It is essential to recognize appendicitis, not because it is the most common cause, but because it is both common and can be life-threatening if untreated. The appendix is a small pouch attached to the large intestine. Appendicitis often starts with gradual and progressive pain. The pain typically begins near the navel or belly button and then shifts to the lower right abdomen. Symptoms include loss of appetite, nausea, and occasionally vomiting. A low-grade fever may also occur. The pain worsens with movement, coughing, or pressure on the lower right abdomen. In children, pain can be challenging to pinpoint and may feel generalized. However, pain that worsens with movement is a significant indicator. A common scenario in children includes initial stomach pain and loss of appetite, with pain increasing and focusing on the right lower abdomen. Parents may notice their child moving less to avoid discomfort. Most cases of appendicitis require surgery, as untreated appendicitis can lead to perforation, causing peritonitis, a serious infection in the abdominal cavity that is life-threatening. The second most common cause of right lower abdominal pain is irritable bowel syndrome. This syndrome involves chronic abdominal pain, usually affecting the large intestine and causing symptoms like cramping, gas, and bloating. Although the exact cause is unknown, irritable bowel syndrome is linked to abnormal gut-brain interactions, meaning the intestines become hypersensitive, leading to frequent discomfort. Pain from irritable bowel syndrome can occur on any part of the lower abdomen, but the right side is a common location. A key characteristic of irritable bowel syndrome is the alternation between diarrhea and constipation. Pain is often related to defecation, which can relieve the discomfort. Changes in stool frequency and appearance may also be present. The third common cause is ovulation pain, which occurs in women. When an egg is released from the right ovary, it can cause right-sided lower abdominal pain in the middle of the menstrual cycle, typically around 14 days before the next period. Around 20% of women experience ovulation pain. Although usually mild, this pain can feel sharp or cramping and may last a few hours to 2 days. Roughly 50% of ovulations happen on the right side, while the rest occur on the left side. The fourth common cause of right lower abdominal pain is kidney stones if they are located on the right side. When hard deposits of minerals and salts form in the kidney or ureter and obstruct urine flow, it can cause severe pain. This pain commonly radiates to the lower part of the abdomen. The pain is sharp and may spread, often accompanied by nausea and blood in the urine. Pain from the kidneys comes in waves. This is called colicky pain and is due to intermittent spasms of the ureter. This can start in the flank area, side of the back below the ribs, and radiate to the lower abdomen and groin. This pain is usually described by patients as one of the worst pains they have ever felt, starting suddenly and increasing in intensity. The patient often cannot find a comfortable position due to the pain and may move restlessly, as lying still does not relieve the discomfort. Ultrasound and CT scans are effective imaging studies for diagnosing stones in the urinary system. The fifth common cause of right lower abdominal pain is salpingitis, which is the inflammation of the fallopian tubes. This pain is usually dull and achy, sometimes crampy, and located in the lower abdomen. It often worsens with movement, sexual activity, or urination, while salpingitis usually affects both sides. It can sometimes be right-sided. Salpingitis often comes with other symptoms such as fever, chills, vaginal discharge, painful intercourse, and irregular menstrual bleeding. It most commonly affects sexually active women under the age of 25, and the primary causes are sexually transmitted diseases such as chlamydia and gonorrhea. A common sign of salpingitis is rebound tenderness. When you press on the lower abdomen and then quickly release, pain can be felt in the affected area. For diagnosis, swab tests from the cervix and vagina are often used to test for chlamydia and gonorrhea. An elevated white blood cell count and increased CR-reactive protein levels are also common findings. The seventh common cause is inguinal hernia, a condition where part of the intestine or fat tissue pushes through a weak spot in the lower abdominal muscles near the groin. This results in a visible or palpable bulge, usually in the groin area, and can cause discomfort or pain. Inguinal hernias may be present from birth, but common causes include heavy lifting, aging, or increased pressure within the abdomen. The hallmark of this condition is a noticeable, visible bulge in the groin when standing, coughing, or straining. Patients often feel a heaviness or pulling sensation in the groin, with pain worsening during activities that increase abdominal pressure, like lifting, bending, or coughing. In many cases, a hernia can be temporarily pushed back into place. However, an incarcerated hernia cannot be reduced, leading to severe pain and an increased risk of complications. Inguinal hernia is more common in men and is approximately 10 times higher in men than in women. This is because the male inguinal canal is naturally wider and weaker. Inguinal hernias are also more common in older adults and are associated with heavy lifting and strenuous activities. Other less common causes of right lower abdominal pain include ectopic pregnancy, where the fertilized egg implants outside the uterus, typically in the fallopian tube. The hallmark is a sudden, sharp lower abdominal pain on one side, often with vaginal bleeding. This pain may occur in a woman who is unaware she is pregnant. Inflammatory bowel disease can also cause right abdominal pain, often accompanied by diarrhea, weight loss, and blood in the stool, especially during flare-ups in younger adults. Abdominal lymphadeninitis, which is inflammation of the abdominal lymph nodes due to viral or bacterial infection, can cause pain, especially in children following an upper respiratory infection. Erythemitis, which is inflammation of the Q, often occurs in immunocompromised patients, particularly those undergoing chemotherapy. The hallmark symptoms include fever, severe lower abdominal pain, and tenderness.